Today we're breaking down everything you need to know about medial ankle sprains, what they are, why they happen, and most importantly, how to rehab them so you don't re-injure yourself. Hey Prehab, welcome back. Dr. Arash here, physical therapist, and today I'm going to talk about medial ankle sprains. Now, ankle sprains are one of the most common sports injuries, making up 25% of all sports-related injuries. These are much less common than the typical lateral ankle sprains. These injuries can be tricky to recover from because the deltoid ligament complex is so strong, meaning it takes a very high level of force to injure or sprain that tissue. That's exactly what happened to me. I sprained my ankle playing college soccer when I was 18, and I never got the proper rehab that I needed. I was able to do normal activities like walking and lifting weights. However, this injury kept me from ever returning back to sports or even going for a jog. That's a huge reason why I became a PT, to fix my own issue once and for all, but also to help others avoid the same mistake that I made. The medial ankle ligaments consist of the deltoid ligament complex, which has 4 different components. This ligament stabilizes your ankle and prevents excessive outward or eversion movement. Injury happens when your foot is forcefully rotated into that outward position, commonly in contact sports or with awkward landing. Opposite of the more common lateral ankle sprain that happens when your foot actually rotates inwards. Because the deltoid ligament is so strong, medial ankle sprains tend to be severe and often take longer to heal. There's evidence to support that if your ankle is not rehabbed correctly, your risk of re-injury is very high within that first year, so let's make sure that doesn't happen. Let's start with phase 1. Old school thinking focused on just rest and ice. While protecting this tissue for 24 to 72 hours is important, early movement is key for recovery. I'd recommend performing active range of motion exercises like these ankle pumps shown here. If ankle pumps are no problem for you, I'd recommend going through a larger range of motion with an exercise like ankle circles. I would perform these exercises many times throughout the day for the first few days. All right, once you're able to bear some load into that leg and you're able to walk again, let's progress to phase 2. This is where we introduce strength and stability. Here are 5 of my favorite movements from the ankle sprain rehab program that'll progress into strength and stability. So the first one is just a single leg balance where you focus on putting all your load on one leg. Think about maintaining a tripod. The tripod is the base of the big toe, base of the little toe, and the heel. On all 3 pillars of those tripods, you're just holding yourself up and maintaining this position for a minute. Now, if this is too challenging, you can use the back leg to support yourself a little bit. After an ankle sprain, you want to make sure you improve your balance and proprioception. A lot of times that ligament gets sprained and it kind of offsets that, so it's important to build that up. Now, if this is too easy, you can challenge yourself by getting a load like a kettlebell and moving it side to side, where you're kind of throwing yourself off a little bit and challenging that balance system a little bit further. And that side-to-side motion is going to make sure that you build that stability again laterally, which is what's very important post-sprain. Now, the second exercise that I'm going to focus on is building up ankle inversion strength. That's bringing the foot inwards like this. Remember, that sprain was more of the outward motion, so we're going to actually build the muscles around the ligament that was sprained. What you're going to do is wrap a band around your forefoot, anchor it with the opposite leg, and then from here what you want to focus on is bringing your foot inward like this, using the muscles on the inside of your lower leg right here and the foot to allow for this motion to occur all the way till that end range position. Now, when you come back, be careful. If you feel a bit of discomfort on the inside of that ankle, you can minimize the range of motion that you go through. Remember, a sprain happened because you overstretched those ligaments, so the goal is not to stretch those further. The goal is actually to build up tissue within a comfortable range of motion. So if that motion hurts you a little bit towards that end, stay through less range of motion while making sure that you build up strength of those tissues. So just perform this for 15 reps. If you don't want to stabilize with your hand, you can also, or with your leg, you can stabilize and anchor somewhere lower by your ankle so that you can go through that full range of motion. That's ankle inversion, strengthening the muscles on the inside of the lower leg here. Ankle eversion is going to be actually a very, very important one to build up. So the important part with this movement also is to make sure to build up the muscles on the outside. This is the peroneal muscles. You want to go through as much range of motion that you feel comfortable with. Again, when you go all the way out here, you may notice a little bit of a pull in that deltoid ligament area on the inside. If so, just come off a little bit and go through a range of motion that you feel comfortable with that will still challenge the muscles on the outside there. And you always have the option of making the band, pulling a little bit further or slackening a bit so that way you can reduce or increase tension on the band. Now, a compensation that a lot of people make with this movement is they move their entire leg versus focusing on just moving that lower leg. So to prevent that, keep your knee facing forward the entire time, and the only thing that should be moving is your ankle and your foot, not your lower leg, versus kind of moving like this, which is a very common compensation that people perform, and you should feel the muscles on the outer portion of your lower leg right here working as you do this. All right, let's get on up and do the last two movements in this phase. The next one, you're gonna need some sort of elevation. You can also do this off the edge of a step. This is a heel raise. However, I do want you to focus on going through the full range of motion. You can start with going with 2 legs, but I'd recommend progressing to 1 leg. And then from here, what you're gonna focus on is keeping that knee straight, lift your body up as high as you can. I like going up against the wall so I don't have to worry about balance and I can just focus on building strength of the leg. And once I reach that top position, I'm going to slowly lower back down. And the key here is to go through that full range of motion where at the end, I feel a bit of a calf stretch versus if I was to do this on flat surface, I'm not getting that full range of motion. So this part is crucial to get through that full range. Again, you should feel the calf working with this movement. Shoot for about 15 repetitions here. And if you need to load it a bit further, you can hold on to kettlebells or dumbbells or something else to make sure that you load up that tissue properly. Now the last movement, another movement that's oftentimes overlooked, similar to the ankle eversion exercise, is just a basic dorsiflexion movement, where I like to go up against the wall, back against the wall, and then from here, march your legs out a little bit. The further you bring your legs, actually the more range of motion you can go through compared to if I was just here, I have very little range of motion. So you want to step out a little bit, and then from here, you're going to bring both feet up towards you as far as you can, hold for a second, and then slowly lower back down. Make sure to keep those knees straight. If anything, you can squeeze the quads as you perform this motion, and then slowly return. This is also a similar one with the eversion, because if you sprain the tissues here, you will create tension a bit as you go into dorsiflexion. So go through a range of motion that you feel comfortable with, but will also strengthen that tissue. All right, phase 3 is where it gets fun. This is plyometrics. This is where we get back into exercises that mimic real life sports and activities. So the first one that we're gonna do is a double leg jump, going from 2 legs to 2 legs. So you're gonna do a squat and then create some power, jumping up and then slowly landing and absorbing the shock. Now, at first when you do this, you wanna barely create any sort of elevation. I even have people start with just focusing on the decel aspect of it, the deceleration component of the movement. But if you're up for it, go from 2 legs, jump up, slowly land and control that movement, and then go back and forth from 2 legs to 2 legs. And make sure that you don't compensate on the opposite side. A lot of times people feel like they're gonna irritate or hurt that side, and there's kind of this fear and avoidant behavior. So you wanna make sure to load symmetrically. And if you're unsure, look in the mirror or film yourself, especially from the back, and you'll notice that if this side's your injured side, you may bias towards the opposite. So avoid that, make sure to load 50-50 there. The second one is a bound, going from 1 leg to the opposite leg and back and forth. So for this bound, we're gonna start on the right side. We're gonna push off, absorb shock on the opposite side, control that. I like the balance aspect of this, and then go back and forth. And as you feel comfortable, you should increase not just the height at which you go, but the lateral depth at which you move from side to side. The goal here is to really challenge the lateral stability and making sure that you have a strong push off and also a really strong landing. So I'm gonna give you a few reps of me going through a bit more range of motion where I'm really trying to stretch, reach out, create it as much of a sports specific type movement as you can, where you're pushing with like 90% power, which means you're not gonna do too many reps of that. The last one is a single leg to single leg exercise, a single leg hopping movement. So you're gonna be on 1 leg, you're gonna lower and then push off, jump as high as you can, control that landing, and then repeat that motion for as many reps as you can. Now, with this motion, what you wanna focus on is not just collapsing everything in. You wanna control the motion. So that comes from making sure that your knee comes over past your toe a little bit. Your knee does not collapse in. You're using your quad to control that motion. And then you're also hip hinging a bit to soften the landing. Don't create a stiff, loud noise when you land. You want to make sure that that sound is dampened by absorbing that load through your muscles. And if you really feel up for it, the final movement here is going single leg to single leg with a little bit of lateral movement to really challenge all those tissues on the inside of your ankle. So try these out. Make sure to find ways to challenge the tissues. And if something bothers you, back off just a little bit, build up capacity, and then progress back into that motion. If you have a medial ankle sprain, don't make the same mistake that I did. Rehabbing doesn't stop when the pain goes away. Make sure you follow these steps to fully recover and get back to sport or any high-level activity safely. And if you need a guided, structured program, check out the ankle sprain rehab program in the Prehab app. Hope this video helped. Drop any questions in the comments. See you next time.